Greetings to all the examiners. My name is Chung, and in this final year project 1 presentation, I would like to present on the topic ECG narrative, artificial intelligence approach for upscaling ECG manipulation. Here are the research outline that I have encapsulated in this research. First, we'll actually touch about introduction. Next will be problem statement, and consecutively will be research objectives, research scope, literature review, methodology, research design and implementation, and last but not least will be the conclusion. I will touch about the introduction about this final year project 1 topic. And yeah, in the introduction, an electrocardiogram, which commonly known as ECG or its abbreviation, is a simple and yet painless test that actually assists in measuring and also recording the heart electrical activity through repeated cardiac cycle. The ECG was actually done among the patient through the small electrode patches that an electrical technician or medical professional will actually attach the electrode to the skin of human heart, lungs, and legs. Through the measurement and also diagnosis by using the ECG measurement, the medical professionals were actually able to conduct on a thorough medical review, especially towards heart-related disease such as heart rhythm, risk of heart attack, and at the same time able to check on the electrolytes abnormalities and also detection of poor blood flow to the heart muscle. The impulses will be displayed in a form of Q, R, and S wave of ECG, which will commonly known as the QRS complex. In these figures, it actually indicates a normal heartbeat of an ECG signal, which also commonly known as QRS complex. Next, I would like to present on the problem statement for this final year project 1. First, problem background for this final year project 1 will be the misinterpretation of ECG readings. As the current conventional ECG is universal, however, it can be interpreted and derived differently in accordance to the interpreter experience and skill in this field. This series of problems and bottlenecks may eventually cause that the medical professionals may not able to come into a common ground and at the same time able to come up with a standardized diagnosis for that specific patient. And the next problem background will be delayed diagnosis and detection of heart-related diseases. As the current conventional ECG reading face limited interpretation, as the interpretation will actually need to go through thorough discussion between multiple medical professionals. Hence, this will increase the processing time for the diagnosis and detection of heart-related diseases, as the conventional ECG reading will need to have thorough discussion among the medical professional, and last but not least will cause the diagnosis to be delayed. Next, I will present about the research objective for this final year project 1. So first objective of this research will be to conduct a comprehensive research and review on how the existing artificial intelligence algorithms and their respective effectiveness on their techniques, and also to evaluate the benchmark of accuracy, precision, as well as computational intelligence efficiency of respective artificial intelligence algorithms. And last but not least, we need to evaluate the efficacies and also the performance of the respective artificial intelligence algorithms that are actually going to utilize in this research by utilizing the real-world ECG dataset towards the medical professional on their respective reliability. Next, I would like to present on the research scope for this final year project 1. And first scope for this final year project will be the real-world dataset of ECG will be utilized in order to validate the current effectiveness of artificial intelligence algorithm. And the research will also opted for multiple and various artificial intelligence algorithms to actually evaluate on their respective effectiveness. And last but not least will be the research will also focus on the evaluation on the robustness and also the performance of the artificial intelligence in response to the variations and diversifications of ECG datasets to actually reaffirm their performance in classification of ECG. Next, I will present on the literature review for this final year project 1. In this table, I would like to present on the characteristic of a healthy ECG wave segment. First ECG wave segment will be P wave, where the wave has to be upright in leads AVF V3 to V6, and the duration should be lesser or equivalent to 0.11 seconds. Whereas for PR interval, the desired time interval for this PR interval will actually need to be between 0.12 to 0.20 seconds. The QRS complex, where in this duration it has to be lesser than or equivalent to 0.12 seconds with amplitude larger than 0.5 millivolt in 1 standard lead and greater than 1.0 millivolt in at least 1 standard lead. Whereas for the ST segment, the segment need to be lean and isoelectric towards the T wave in a normal ECG, and also need to be never be depressed more than 0.5 millimeter in any lead. For T wave, it needs to be upright in leads V2 to V6, and it has to be inverted in AVR segment. The T wave deflection should align with QRS complex in at least 5 out of 6 limb leads. For the QT interval, the duration for the interval has to be lesser than or equivalent to 0.440 seconds for males, whereas for females will be 0.44 seconds. And in this final year project, here are a series of artificial intelligence algorithms that will be utilized to evaluate on their respective effectiveness and their robustness towards the ECG classification. First will be convolutional neural network, consecutive will be recurrent neural network, generative adversarial network, random forest, k nearest neighbor, and last but not least will be support vector machine. I would like to present about the convolutional neural network, which also known as CNN. It actually part of class and category of deep neural network, and it also consists of 3 different functional layers, which consists of input layer, convolutional layer, and also pooling layer. And they also need to continuously update and also refresh the read metrics through training with Torah datasets. And the next neural network that I would like to present, which is the recurrent neural network, also known as RNN. It is a distinct artificial neural network which will focus on utilizing the sequential data, and will also need to leverage on backpropagation through time, where in this backpropagation through time, which also known as BPTT, it will sum the error at each step, where it will actually feed forward all the networks and do not need to sum errors as they do not share any common parameters across the layers. Thirdly, support vector machine, or commonly known as SVM. It carry out data classification, regression, as well as came in handy when it needs to classify for outliers detection. And in SVM, it actually aims to find the best hyperplane in an n-dimensional space where the hyperplane seeks to maximize the margin between the nearest point of different classes. Next will be random forest. The random forest will normally encapsulate and combine the output of multiple decision trees to achieve and reach the desired results or outputs. 2 common methods were actually executed in this random forest, which is voting or averaging. Hence, in this result prediction phase, the random forest algorithm will actually coagulate and also aggregate all the results that have been processed by the individual tree and will actually come out in one single result. Next will be k nearest neighbor, where in this k nearest neighbor, it consists of a supervised learning artificial intelligence algorithm that actually aims to search and seek for intense application in terms of pattern recognition, data mining, as well as intrusion detection. In this KNN algorithm, it will also operate by identifying the nearest k nearest neighbor to a given data point by using various distance metrics. In k nearest neighbor perspective, Euclidean, Manhattan, or Minkowski distance are actually the common distance metrics that will be utilized by k nearest neighbor to actually identify the nearest k neighbor. Last but not least will be generative adversarial network. It actually made out of 2 neural networks, which is discriminator and a generator. In generative adversarial network, it actually consists of 6 discrete processes in executing, which is initialization, the first move by generator, the discriminator turn, and the learning process from the generative adversarial network, the generator improvement, and last but not least will be the discriminator adaptation. Next, I would like to present on the methodology that I will be implementing throughout this whole research. This is a Torah diagram on what are the methodology that I'll be going to execute in this research. This is a brief explanation on the methodology that will be utilized in this research. In phase 1, research topic and also objective identification will be identified to ensure that I have a clear topic and also objective on what is the research that I actually going to utilize, which is to identify on which suitable and effective artificial intelligence algorithm in classifying ECG. And also next we'll be conducting a thorough literature review for my research. In phase 2, where in this phase, I will have to prepare the data set. After the preparation of data sets, I'll actually need to pre-process the data sets to ensure that there is no error in my data set. And last but not least, I will need to segment and also normalize all the data sets. And in the consecutive phase, I will actually train my algorithm. And after train my algorithm, I actually need to evaluate and also analyze on the algorithm to ensure that it able to fit in the validation of algorithm. And in last phase, it will be report writing and documentation. I would like to present on the hardware and software specification that I actually utilize throughout this whole research. Where hardware specification, I actually utilize multi-core processor of Intel Core i7 and consists of 16 GB RAM and also 1 TB storage of SSD. In software specifications wise, I actually utilize Python, TensorFlow, Jupyter Notebook, and Visual Studio Code as my coding environment to actually carry out my ECG dataset preprocessing. And for the operating system wise, I have utilized Windows 11 to actually carry out my research. Next, I would like to present on the research design and implementation. And in this research design and implementation, as I will actually only focus in phase 2, which is to pre-process my dataset and also to prepare my dataset to ensure that there is no error or any deviation to be trained for the algorithm in my next final year project 2 planning. So first will be data loading, ECG signal reading and loading, continue with aggregation of diagnostic information, and the next will be signal filtering and notching of the ECG datasets. And next will be data normalization and R-wave checking. And last but not least will be segment extraction. First, I would like to present on what is actually being done in aggregation of diagnostic information, where actually aggregation of diagnostic information is actually really useful in order to simplify the diagnostic label and also the simplification of the diagnostic label to actually ensure that all of the data were actually able to be reduced their respective complexity to actually let the algorithm to deal with multiples of ECG pattern with more ease. Next, you're actually able to assist the algorithm model in creating a more robustness to actually ensure that the artificial intelligence algorithm to have more performance in terms of analyzing the signals with less error. And also in this aggregation side, it actually important and vital in increasing the interpretability once the aggregation is completed, as currently once the aggregation of diagnostic information have been completely done, all the ECGs in the data set will actually be distributed evenly. And in this diagram, it actually shows that the plotting of the first common ECG signals which actually being plotted through the aggregation of diagnostic information. Next, I would like to present on the signal filtering and notching of the ECG datasets. It is actually a very important and crucial step to actually being executed in dataset preprocessing, as in signal filtering and notching of ECG datasets, it actually able to enhance data quality and also able to identify on the biologically relevant features. In this section, several factors such as baseline wandering, muscle noise, as well as the power line interference actually possess risks, as they will actually affect the quality and also effectiveness for the artificial algorithm to classify on the signals, as these factors will actually interrupt the data and causing the data to be disturbed with all the external factors that I have listed and mentioned just now. Hence, for the notching side, the ECG spectrum actually need to be notched in order to ensure that the power line of the specific ECG signals will be attenuated within 50 Hz to 60 Hz. Between this frequency is actually the most desirable frequency for the ECG to be performed so that the artificial intelligence algorithm can actually utilize all the attenuated frequency to actually being pre-processed and ensure that the artificial intelligence algorithm themselves can evaluate in a more effective manner once that all the ECG datasets have been attenuated within 50 Hz to 60 Hz. This attenuation will actually effectively remove all the power line interference that have been spotted and discovered in these ECG datasets, as it will actually not affect any other parts or segments that have been induced or have been included in these ECG signals or even in the whole ECG datasets. Hence, this diagram can actually clearly show the difference between original ECG signal and also the filtered ECG signal, where it actually can show that the signal have been attenuated to actually ensure that the artificial intelligence algorithm can actually clearly identify and also classify all the ECG signals with ease. Next, I would like to present on the data normalization and RF checking phase in this dataset preprocessing phase. Data normalization is actually important to be executed in data preprocessing phase to actually ensure that the data normalization will able to transform the ECG data to a standard scale without distorting and disturbing the differences in the range of values. Hence, after we conduct the data normalization, the RF checking will also be conducted in this phase to actually ensure that the accurate RF detection will actually be executed by the algorithm in the future mean, and then at the same time will actually align with the current ECG cycles accurately which have been executed. And in this slides, it actually can clearly show that the R wave has been clearly detected, and it can be seen and shown that the R wave is actually consists at the highest peak of a specific ECG dataset. Last but not least, I would like to present on the segment extraction. The segment extraction is actually important and crucial to be executed in dataset preprocessing to ensure that the analysis will be more focused on certain segments that have been included and inclusive inside a specific ECG signal. In this segment extraction, it is also important to actually ensure that the data will be normalized and also able to compare various habits that is actually coming from different datasets. In this mean, it will actually enable the artificial intelligence algorithm to actually get trained and get more familiarized on how is a healthy ECG is going to look like once we have extracted the specific segment coming from the specific ECG dataset with that specific attribute. Time measurement is also included in the code snippets to actually ensure that the performance evaluation were able to be conducted, and at the same time we're actually able to track the progress of the pre-processing of the ECG signal, which is useful due to its vast amount of ECG datasets has been encapsulated in PDB-XL set datasets. In this diagram, it actually can show that the respective extraction of segments in different ECG signals. Last but not least, I would like to present on the conclusion for my final year project 1. Achievement of project objective that I have actually achieved so far is a thorough research framework has been developed and identified in order to ensure that the research development process and phases can be executed accordingly to ensure that the execution of phase 1 and phase 2 during my final year project 1 preparation can be fulfilled based on the processes that have been defined in the research framework. As I mentioned previously, phase 1 will be consist of the identification of my research objective, problem statement, and also to conduct a thorough literature review. And in phase 2, I have conducted a thorough dataset preprocessing as well as dataset preparation to actually ensure that my datasets can actually be carefully preprocessed and ready to be trained and also to be classified from my artificial intelligence algorithm in my next final year project 2 planning. Hence, after I develop that specific research framework, it actually really useful to serve as a guideline for me to carry out my final year project 1 in a correct timeline and at the same time able to fulfill on the framework that have been developed. Next, the research planning and also initial studies for the final year project has been finalized and initialized in the first place, and also the literature review on the respective artificial intelligence algorithm have been finalized. As for the literature review, it's very important that I've finally achieved and I have finally solved and also discovered on all the necessary information that is actually needed to ensure that the artificial intelligence algorithm have the necessary information and also at the same time able to be finalized on my literature review. And last but not least, I have also successfully achieved on data preprocessing phase, where in this phase I have successfully extracted, normalized, segmented, filtered, and also preprocessed all the data before all these data were actually being sent to the algorithms for thorough analysis and classification. Next, I would like to present on my future works and planning. So on my future works and planning, the development of the artificial intelligence algorithm will be initiated, and the pre-processed datasets that have actually been done in my final year project one will actually be served as the main datasets that are actually being used for the model training. After the development and also after the development and also all the classification have been done by the respective artificial intelligence algorithms, the effectiveness as well as the performance of the artificial intelligence algorithms will actually be carefully evaluated and determined by the mean of performance measurement that have been listed, which is accuracy, precision, and recall. Last but not least, once all the evaluation as well as the development have been done, the documentation of the findings as well as the analysis for that specific artificial intelligence algorithms will be carried out to actually ensure that a proper documentation can be presented and documented to discover and determine on which artificial intelligence algorithm will be more superior in terms of classifying the ECG datasets. That's all from me. Thank you.